So the days of major surgery for facelifts and the downtime to recover are quickly becoming a thing of the past. These days, people can get those wrinkle-reducing procedures over their lunch break and then head back to work. We've been hearing about this in the news for some time, and there are a lot of procedures out there that I was really skeptical of. And right now, board-certified dermatologist Dr. Holly Gunn from Lancaster Skin Center is here. And you were in our studio months back, and I was inquiring a little bit, very interested in these procedures to see if they work. I'm 37 now, throw that out there. It is what it is, but as we age, things happen, and so I was very curious. We talked last week about Xeomin, which is kind of something that it's an injection in the forehead that definitely softens the wrinkles there. And this week we're going to talk about Radiesse. I got another. It's a filler in the cheeks. Can you tell us about that?
You can use Radiesse for any wrinkling of the face, and one of the ways that I like to use it is in the cheeks, because I like to use it as a deep dermal filler. And one of the things that I noticed about myself, because I consider myself the aging female, is when I had my 2 children and I lost a lot of weight afterwards because I had gained like 70 pounds, I noticed I was like, well, my cheeks aren't full anymore. And Radiesse was one of the things that I loved, because I could take my cheeks back to where they used to be. So these are types of things that you can end up going overboard and looking ridiculous. And we've seen those people, but I like using them to just replace what we have lost. And that's truly how you age gracefully and maintain the healthy appearance of your skin and your face. So it's maintenance. So how did you like yours?
Well, see, the thing is, yeah, I was nervous about needles. I have all the fears, nervous about how safe this was to use, and you reassured me, and we had good conversations about all that, and we have all that on our website, the interview with you about those concerns. But it really does fill the face in, and I do think after having children, a lot of women, everything changes, and you do notice changes in your face, and that is one of the spots that you feel like you lose some of the areas.
When you're younger, your cheeks are up here, your high cheekbones are like right underneath your eye, and as we mature, as I like to call it, because I hate to say aging, but they start dropping down, and then they start pushing on your lips, and that's what causes that major crease of the nasolabial fold. So you can use it to just fill in that crease, or you can just boost up those cheeks a little bit, give you back your high cheekbones.
Well, this is something that lasts a little bit longer. I know when I had that done at your office, we had that conversation. Definitely lasts. How long does that typically last?
So typically at least 12 months, if not even up to 2 years. And speaking of bones, it's actually made out of the same material that bone is, but it's a lot softer. It's not as hard as bone. So that's why you can put it right underneath the skin. It feels like normal skin, but because it's more robust than, say, like hyaluronic acid fillers, which we're going to do next week, it lasts a lot longer.
Okay, and you know, we took some before and after shots in there. I always cringe showing these because, but it is an impressive before and after, because it does show that lift there that is incredible.
Yep, and it can be very subtle. Like, it doesn't need to be drastic to still, again, it's very subtle changes that can give you a drastic in the way people think that you look as far as your aging and what age that they would guess that you are. Very subtle changes can do that for you, and that's the way I like to use Radiesse.
All right, well, I'll tell you what, just to make sure that people can see that, I'll put that on our website, fox43.com, and also a link to Lancaster Skin Center. Thank you so much for coming in and joining us this morning.
Thank you for having me.
We'll catch up with you in a week to talk about some other stuff, and let's get a check now on the weather with Jeff.